this really sad statistic about Black and brown people dying 3 times more than white people in birth is kind of a statistic that's going all around. And it breaks my heart. And I wondered if you could speak to that. Why do you think that is, and how can we help?
Yeah, it's a statistic. I'm all too familiar with, being in school right now and studying those statistics, and I'm removing the word disparity from my vocabulary. I just recently attended a people's tribunal where that was the charge from some of the experts. Like, we're going to stop calling these things disparities because they're not disparities. It's obstetrical violence and obstetrical racism that are the determinants and the issues and the problems for maternal health care and Black maternal health care specifically. So that's 2 of the reasons right there. Obstetrical violence and obstetrical racism are disguised as something else, so it's not addressed and called a spade a spade. A lot of the times you think that the way you're treated is how you should be treated until you know that it's not, until someone exposes it and, makes you aware that people hadn't been asking your consent to touch your body, enter your body, test your body, put you through certain things that you didn't even have to because choices weren't presented to you. Not having culturally competent providers is a part of that. And providers of the community, people that it's not just about looking like the community, it's living in the community too, and understanding what you're dealing with and what, our resources and our real gaps and barriers and obstacles are. I know when I'm supporting moms in a certain side of town, what they need versus when I'm supporting moms in a certain side of town, what they need and the times of day when they need it. And, what goes into making that a reality. Part of it is obstetrical violence and obstetrical racism. And then the other part of that is this continued lack of accountability in our responsibility to be proactive and engaged in our pregnancy, postpartum, and interconception journeys. That time frame in between children is very important. Very important. It is slept on, it is not talked about, and it brings people into pregnancy. So that period before or after into pregnancy or out of pregnancy, more at risk. This stuff shouldn't happen. But again, it comes down to feeling things and ignoring things or waiting, to get answers and not getting second opinions and not pushing people to hear us and investigate some more. So yeah, it's just this, it's a really unfortunate statistic that I'm hoping changes for the better because more people become aware of the role that they can play and should play in their journeys, tracking our vitals at home, knowing what your pressures normally run, knowing what your triggers are for high pressures and low pressures and food and diet, knowing family history and birthing history and breastfeeding classes and birthing classes, childbirth classes, pelvic floor therapy, chiropractics, massage therapy, mental health therapy, all of these things. There's just this, again, just so many things we have to do other than have a baby shower.
Yeah.
Have a gender reveal, do a maternity photo shoot, and pack a hospital bag. Like those things are real things we need to do. And are we sure that we know how to breathe to get through the marathon that is labor? Are we sure that we understand what sides of our body are tighter or looser and won't allow a baby to engage to give us a fair chance at a vaginal birth? Like, that's the type of like connectedness we got to get with birth.
And it really sounds like the work you're doing as a doula, a lot of it is really listening to the mom and really getting to know her as a whole person in all aspects of her life. And by doing that, you're showing her how to do it for herself. So really you're doing a lot.
Man,
Uh,
I want people to feel prepared to advocate for themselves and their child, whether I'm in the room or not, whether they've met the provider or not, under, high stress situations or not, because you can. It's all about just exercising the choice to do it, but you can. You don't have to be a medical expert to advocate. So just ask why. Why now? Why not
yeah.
later? What
And in
happens if
order
I
to
wait?
do that, you have to have been listened to by somebody,
Mm-hmm.
to
Mm-hmm.
know what it
Mm-hmm.
feels like for someone to really listen to you. And that's what doulas do, and that's what you're doing.
Yep. Helping people just get familiar with inviting people to act versus
Mhm.
allowing people to do. Like,
Yeah.
no, it's an invitation at all times. At all times, especially with my body and my baby. It's an invitation.
Yeah. And I'm so sorry that so many people have to have this like lioness mentality when they go in to give birth. That my dream and vision is for birth to be just the beautiful thing that it is, a time for connection and bonding, and we don't need to put on our warrior suit.
And Catherine, the amount of times and the way I get to experience that now in clinicals, under the midwifery model of care, I want more people to know that it is here, it's happening in this city, and it's in a place that takes insurance. Like it's possible, it's happening. Midwifery is going to come back to the forefront of the thing that's going to help us reclaim our space and place and voice in birth and in postpartum. Because I see people come here, third or fourth baby, and leave like, I've never had a birthing experience like that. Because first off, you're leaving 2 to 3 hours after you've had the baby. You're going back to your house,
Mhm.
and then somebody's coming to your house to take care of you. Like you need to feel covered like that and heard, like you said, heard.
Mhm.
It makes it easier to ask for help when you need it.
Yeah, absolutely. So you are, Choices is a place where you can give birth to, and is it a birthing center?
Yes, so it's a freestanding birthing center here in Memphis, Tennessee. We're located at 1203 Poplar, and we take almost all insurances, definitely Medicaid. We take Tennessee Medicaid, and it's intentional because we understand the population that we're supporting. And our state allows all pregnant people to get Tennessee Medicaid, so that's strategic as well.
Oh,
But yeah, free out of birth hospital with certified nurse midwives, women of color. Most of our staff is women of color, but we also have a full clinic downstairs where we offer wellness services. And so, like I see them for my well woman care. They are my providers because they're nurse practitioners. There's just this misunderstanding about the scope of a midwife and what they can do.
mhm.
They can provide well woman services. I haven't been back to the OB since.
Mhm. And are there also doulas at Choices?
Not yet.
Okay.
That is something that is very much in the pipeline and on my vision board to leave this space and place better than I found it. Um, I'm a doula trainer, and so one of the things that I'm working on is figuring out how to create a community doula program here in Memphis,
Mhm.
and allowing Choices to be one of the places where I pilot, and then in my personal business as well to kind of expand what the doula into being an agency, because there are lots of people doing this for the monies, and I want to see a lot of people get the advantage of this service with whether they have the money or not.
Yeah.
And
Yeah.
get the clientele whether they have access to the monies or the funding or not. I think that was one of the things that helped me again get confident and be very successful in my early years. I was a community doula with Birth Strides. It's no longer existent, but I want to fill that gap because
Mm.
there is one. And again, like my background isn't in education for no reason. And I think God gives us gifts so that we can leave the world better than we found it.
I agree. definitely. Well, thank you so much for the work that you're doing in Memphis. And it might just be Memphis, but then the people that you help, they grow up and they move away, and yeah, it's a ripple effect. So thank you for the work that you're doing in the world, really.
Thank you.
Mm.
Oh, fun thing I get to tell you, I did a pitch competition earlier this year, and it was cool to put your logo up there as one of the
Oh,
people that made the impact that I was able to
oh,
have since inception up there. 'Cause, I mean, I've only gotten 2 or 3 grants, and you were the second one. So it was cool
oh,
to
well,
have your logo up there, right by Comcast, and right by GoFundMe. You up there with the big dog.
Oh, good, good, good. Well, we're just starting out too, so knowing that you're rooting for us at the Global Doula Project means a lot.
Yes,
Mm.
yes, of course.